Great to have you on the podcast. How are you today?
I'm great, Jared. Nice to be with you.
Would love to first kick things off. Every time I have a guest on, I just give them a second to give a little bit about their background for the audience and what they're working on today, and then I have some cool questions around AI and healthcare, and we'll have a good chat.
Great, let's do it. So I'm Sven Gierlinger. I'm the Chief Experience Officer at Northwell Health. We're the largest health system in the state of New York, and actually also the largest employer. We operate about 21 hospitals and have a very massive ambulatory network also with about 900 locations. So we're a big player on the East Coast. And I've been in healthcare now for the past 16 years or so. But before that, I had a career in the hospitality industry. I worked for luxury hotels, worked for the Ritz-Carlton Hotel Company for a long time. And I'm really happy to be in healthcare now, actually. It's a fascinating field and so much going on and lots of opportunity to improve the experience of our patients.
Coming from your previous background, were there any immediate kind of parallels that you saw between the hotel space and healthcare?
Yeah, there's some parallels. There's a lot of parallels, but there's also enormous differences between the industries. One of the things is that in the hotel industry, we always talked about that we're in the relationship business, right? We are building relationships, we're building trust with our guests, especially at Ritz-Carlton, no matter where they stay in the world. We know them and we take care of them to their preferences. That transfers into healthcare. Healthcare is, the ultimate relationship business if you think about it, and what we know about patients and how much trust they have to have in us as a provider network. But then the fundamentals of the business are just so different, right? From the way it's structured, the regulatory components that you don't have in hotels, the way we get paid, the academic side. Those are all, um, you know, differences, and in some cases barriers that doesn't make it as easy to deliver on the experience like we do in hotels and hospitality. There's lots of lessons learned that can actually transfer directly in terms of creating the human experience to focus on what we call the expressed and unexpressed needs of the individuals. The need for making great first impressions to build that trust right from the beginning. Those are all very important elements of an experience. And it's also interesting to see how the hotel industry has changed over the last few decades, right? And we'll talk about technologies, how technology has really been woven into the experience. Very different from when I started in that industry several decades ago.
Would love to your thoughts. I love this role. I feel like over the last several years, this chief experience officer, we've seen that a lot more in healthcare, and it makes sense, right? Because we need to be providing a better experience for patients, and there's obviously other factors that come into play. But for this conversation today, I'd love to focus, just given the nature of Human X coming up, is can you share some like real world examples of how hospitals or clinics have successfully used, let's talk about AI. I mean, I know probably the obvious ones are these scribe type tools, but like what are you seeing, and then how do you see AI continuing to enhance patient experience moving forward?
Well, I think that the tools that will ultimately be successful that we have at various stages of implementation and that we're testing with are going to be the ones that make the experience easier for the patients, but also for the providers, so that the providers, and I use that term broadly. It's not just the physicians and the advanced care providers. That's the nurses, anybody who has access to information that interacts with the patients, that it's easier for them, and that they can reinvest that time back into the human interactions and to build that relationship that I talked about earlier. So some of the things that I'm really excited about is, when we talk about scribes, is that augmented is the ambient listening technology that's out there. Several companies now. We're having 3 pilots going on right now. We'll end up with one to go with. But that's every physician, particularly that I've spoken to, that's using that technology. They love it. Um, but still at first they have to you have to use it to be able to trust it, right? And they're telling me that it just makes their job easier. They don't have to spend so much time documenting like they do before, because right now they spend their whole day in the clinic, then they go home, have dinner with the family, and then they're up until midnight to finish their notes and respond to the in basket, and to do all those things. That will help also with the issue around provider burnout that's been really prevalent through healthcare. But I think most importantly that they'll be able to reinvest that time and that energy into patient care, because if you look at it, the last 2 decades or beyond, physicians have spent more time with a keyboard than with patients. So I see the keyboard going away to um, making sure that they will take that um, machine away basically, and go back to practicing medicine the way that's supposed to be done. Another one is like the I think what's called the intelligent chart summarization, right? So if you think about complex patients, there's just an enormous amount of data about them in the chart. What's important to that physician that is seeing that patient now, and it could be a specialty physician, and could be their primary care physician saying, summarize a chart for me for this particular visit. And then because that's what happens a lot also, I don't know when you go to a doctor, but you sit there and they scroll through your record and find things that they need to look at, and again, they spend more time with the computer than with you actually. So that's something that's going to be extremely helpful for the providers. And then the what's called the augmented response technology, where the technology can basically filter through all the the messages that come in through the in basket, can also triage it to the right person, because it's not always the physician that needs to answer that, right? Here are the ones, these can go to the nurse practitioner, these can go to the nurse, these can go to an office staff member, they can answer that, and then at the end there's some left that the physician has to answer. And then using the technology to already draft the responses. And what's really interesting there is that several studies have been done already where the perception of the patient is that the responses that were created by the technology are actually more empathic than when it was done by a provider. So there's more empathy. Why? Because they have more time. The technology has more time to do that, right? They can put some niceties in there and make it sound better, because often the responses from physicians are just shorter because of the time constraints.
There's obviously like, there's some things that you said in there where we implement, like clinics implemented this and the clinicians love it, right? They have more time with their family. They're like, when we talk about the ambient like technology. Now, you said something in there, it's like, and they love it. Here's my question to you. There's so many things in this technology that we start implementing that the clinicians love. There's certain blockers in healthcare, right? We have to still be careful of how quickly we implement certain technology, more so than other industries. But it's always funny to me when I hear, and they love it. Did we think that they wouldn't love it? Like, I guess, you know
Well,
what I mean?
they may not love it at first, though. Also, I think that's an important piece, because they have to first trust the technology. And, I compare it to self-driving, right? So people are very apprehensive. It shows that actually there are less accidents with the technology than when a human is driving it. But we feel we have a lot more control when we have the steering wheel in our own hands. But I have a car that has self-driving capabilities, and or autopilot, and I use it, but I use it wisely, and I feel I'm more relaxed driving that way because I still have the eye on the road. I have my hands on the steering wheel, but the car just basically does everything that it needs to do. And the same applies to this technology. That you don't trust it right away until you actually see how it acts, how it responds, how it creates those workflows that you're so used to doing, or that it does the work for you. And then I heard somebody say recently, and that who said that AI will not replace people, but it will replace people that don't use AI, and that's basically what it is. And but yeah, so it's going to take some time to get physicians to trust it, I think.
So a big reason self-driving has progressed to the point that it's at today, and I think we're very, very close on that front, right? And seeing like some of the
But
what
we've
these
been
cars.
saying that we've been saying that for several years
I know
now.
it. It well,
But
it's
why?
yeah. Well, it's a laughable thing about AI too is there's always a soundbite that says in 6 months this will happen. In
Yeah.
6 months this will happen. I was just going to ask you in terms though of when it comes to a big reason for self-driving though progressing at all is because of where AI is at today, right? And being able to make better decisions in healthcare. Where do you think the quote unquote self-driving capabilities will potentially pop up?
I
Is it
think
is it difficult because now you
we
have
have
the
the
patient experience?
capabilities now. It's the
Mhm.
whatever that speed of trust is, right? Healthcare moves at the speed of trust, and trust on the provider side and trust on the patient side, and it's accelerating a lot. I wouldn't be able to give a time frame, and I'm not an AI expert. I look at making sure that we implement and use these tools and help bring them to scale also then.
Yeah, I think even more so than the self-driving cars, when it comes to healthcare, we are because like when you think of a robot, and not the robotic surgery that we're used to today, right? But like a robot that's doing fully the whole entire surgery, how would most of your patients feel, right, about that? They might,
How would you feel if a robot is putting an IV into you, right?
or if
And
a
I don't even
robot,
know if they can, but that's where the human connection is so important, and
and then I guess
the empathy.
at what point? Oh, sorry to interrupt. I was just
No,
gonna
go
say,
ahead.
at what point um, does the robot start calculating odds more too? Of like because like there's some cases right where the odds are low that you can still do something, but a robot might say no, like and just cut it. So like I still think we are probably in healthcare when it comes to that total obviously automate like probably further along than some industries, but we have to be because it's that we have to be way more cautious.
Right.
Um, what I guess opportunities do you kind of see to continue to improve, and what concerns do you still have regarding AI?
The concern's still on the direct to consumer side. We're talking here in the medical encounter, but there's all the other things on the phone systems, for example, and how people call in. I think we need to mature those systems a lot more, so that patients don't get customers, for that matter, don't get as frustrated as they sometimes do. And because often they say, just give me a person, right? But technically, the AI technology has more capabilities than the person, but they just get frustrated. So that they become, and that is maturing as we speak, and I think that can ultimately be very, very helpful to really adopt these technologies at scale. We have 89,000 employees with our we employ 6,000 physicians, 20,000 nurses, right? So I'm looking forward to all of them using it. But it is definitely, we're not there yet, but we're introducing, we're doing pilots, we are building that trust, so that we can spread it faster throughout the organization.
Thank you so much for coming on here today, sharing some thoughts with us. I'm looking forward to meeting you in person at the Human X conference. Should be a great event. And let's definitely stay in touch. Anything that you think is coming up in the space that you want to talk about, let us know, and we'll put something out there. But thank you so much for joining us here today.
Sounds great. Looking forward to meeting you at the conference.